Good afternoon, everyone. Good afternoon, everyone. Did you have a good lunch? Nice. Great pleasure to introduce Jane Ellison, MP, Minister for Public Health. Jane is the MP for Battersea. It's my spiritual home. And we've worked together almost for all the time we've been together in my role and Jane as the Minister. She'll convey the passion and the ambition which has been obvious to me from the outset. We are in truth a partnership. Mutual exchange of ambition and tagging each other about doing better. So my privilege to introduce and to say to you, this will be another great session and on which to build over the course of the next day or so. So Jane, over to you. Thank you.
Thank you very much, Duncan. And I echo your words. It's been a great pleasure working with you over the last year. And I've really enjoyed the role of being Public Health Minister. So it's fantastic to be here with you all today. I know how much expertise there is here in this room and how much you do to advance the health of the public and to improve the health of the public. There's been obviously a huge shift over the last year in how we deliver public health services with the move of responsibility from the NHS to local government. So it's a great testament, first of all, to many people here that transition went so smoothly. Almost went so smoothly that we forgot to say it was actually a really big deal to deliver a smooth transition, and it was, and it did go well. So thank you for that. And I think we've also seen PHE coming into its own this year on some really major public health issues. Not least, most recently, the Ebola outbreak. And I'll come back to that in a moment. But PHE has also been spearheading some fantastic new and innovative public health campaigns alongside what have become very much staple fixtures of our public health calendar, such as Stoptober, which we're about to go into, and already 40,000 people signed up, which is absolutely remarkable. Local authorities too, working with PHE, have shown, I think, that they're ideally placed to devise and deliver public health strategies in a way that will have the most benefit for their local populations. I passionately feel that we've got public health in exactly the right place with the right leadership there. It sits so well with local government. And taking those two things together, I believe it is accelerating improvements in public health across the country. First, let me just go back to Ebola, because it's a great example of the system really working. I would like to take this opportunity to acknowledge the huge amount of work that PHE have done and are doing to support the government in preparing the Ebola response and for their role in providing support in those countries that have been so badly affected. PHE's collective public health knowledge and experience has been invaluable. There was a lot of meetings over the summer. It wasn't a quiet summer on so many fronts. And their expertise has been core to the role. Expertise in disease transmission, in diagnostics, and in infection prevention and control. And, whilst those may seem like core public health disciplines we perhaps pass over too lightly, what's really come home to me this summer is that we can't take them for granted, because it is the absence of many of those basic controls which is accelerating West Africa's tragedy. So they are important, and PHE has been extremely helpful in pushing that forward. Also playing an important role in supporting the global response. The UK is taking a really important role in that global response. We can be proud of the way we're working with the World Health Organization and others to ensure the best advice is available and that appropriate actions are being taken in countries affected. And, I would like to take this opportunity in particular to put on record the government's thanks and admiration for those people who are actually in the countries affected, Public Health England staff and NHS staff. I read an email from a lady called Ellison, who's a PHE official, who emailed from a Sierra Leone hospital. And it was a devastating email to read. She just arrived and she sent us a sort of an impression of how things looked on the ground. And the bleak reality of the situation was very real. But I do want to say, thank you to those people, the everyday heroism of those who are voluntarily going out into those difficult situations and lending a lifetime's expertise to try and save other people's lives. Duncan said earlier in his introduction that there are no silver bullets to solving the public health challenges we face, and he's absolutely right. It is about getting that balance of everyone working together, whether it's innovative interventions from local government, the role of national legislation of government, individuals taking personal responsibility and action by industry. Working together, all of those things, we can achieve our goals, but we can't do it, no one part can do it on its own. Just looking at some of those relationships with businesses, I welcome the fact that many businesses are responding to the challenges we face, and that constructive partnerships are being forged between public health and industry. Some of you will have heard me say, perhaps at other conferences, that my background before I entered Parliament in 2010 was I was in retail. I worked for the John Lewis Partnership for 23 years, a company that took the health of its employees extremely seriously, and most of the first public health messages I got through my employer, and I'm really passionate about the role of business and good employers in pushing that. But we've seen results from those partnerships. Businesses are adopting front-of-pack labelling to empower consumers with more information to help them lead balanced diets. Many more supermarkets are now deciding to stop selling sweets at checkouts, a response to calls from their customers to help them lead healthier lifestyles and help their children to lead healthier lifestyles. Proof that you can please your customers and offer health leadership at the same time. PHE has also worked this year with Disney to encourage children to do regular bursts of exercise each day over this summer. I saw this launched up in Upminster at a fantastic, really joyful occasion, and that partnership has got 250,000 families signed up to the 10-minute shake-up. And if proof were needed, it proved to me that Mickey Mouse has certainly got a greater reach than any minister. Just a few examples of how great voluntary action and partnerships with industry can really work. And there's lots to building those relationships. I don't underestimate the time and effort that goes into them. But of course, there is a role for legislation. I do want to take this opportunity to update all of you as health leaders on where some of the legislation that you are particularly interested in is at. And where we're taking forward legislation where it can contribute most. And Duncan rightly focused on tobacco control in his opening remarks. We are banning smoking in cars with children. The consultation closed in August, and we're now preparing to bring regulations before Parliament. On standardised packaging, again, the consultation closed in August, and those draft regulations have now gone to Europe for a statutory standstill period, minimum of 3 months, but in practice it tends to always be 6 months with any tobacco control measure. That's something we're required to do by law. We're also banning the sale of e-cigarettes to under 18s. We don't want to see children or non-smokers starting to use these products as a gateway into smoking. We know it's an area that provokes lively and sometimes controversial public debate. But we want to make sure that we're in a good place with it. We acknowledge the role of e-cigarettes in helping smokers to give up. We all know that examples of that, and we're beginning to see some emergent evidence on that. And we're working with PHE and the MHRA to ensure that there's a choice of e-cigarettes on the market, manufactured to a good quality, that are only attractive to smokers. We want to make sure they are that quitting aid and not a way of getting a new generation of people into smoking. And an interesting area, I think, of where actually a market can sometimes outstrip in its speed of development the science and the evidence base, and that's a great area in which government is going to be looking to PHE to give us that evidence base for policy in the future. And we expect to consult on those regulations, the ones on banning the sale of e-cigarettes to under 18 shortly. Tobacco displays are going in smaller shops in the spring, and we're also looking to close the proxy purchasing loophole that still makes it legal for adults to buy cigarettes for children. I hope you agree that's a strong package of measures to help protect children and promote a healthier future for all families. We're also taking forward, we want to ensure that we support new and cutting-edge approaches to improving health and preventing disease where the science supports it. One of those examples is mitochondrial donation. I was responding to a debate recently in Parliament where many MPs spoke passionately about these procedures, which can have been developed by UK scientists, first in the world to develop these techniques to prevent devastating mitochondrial disease, which is often deadly for young children. We're giving further consideration at the moment to the HFE expert panel's recommendations before putting regulations before Parliament. But this is very much one of those areas that some of you will remember a crossroads we stood at some decades ago with things like IVF. And we're very conscious that where we've seen that new science, those new techniques, that we need to look at how we can make sure people get the benefit of those safely, but also in good time. I want to just turn a little bit to personal responsibility. It's something that often comes up in discussions about public health. Where does the individual fit in? Where does our personal responsibility come in? Because legislation and voluntary action won't work unless people are ultimately willing to change behaviour. But for people to take that personal responsibility for improving their own health, they also need reliable information about the consequences of their behaviour. All of us do. We all need to know how the things that we might choose to do will affect us, either for good or bad, in order to make those informed choices. And it isn't easy for the public. I've said this before, but there are a lot of conflicting messages out there about health. It's quite possible to line up the newspapers for a year and discover that pretty much everything gives you a terrible disease and pretty much everything cures one. So it's no wonder that the public is sometimes confused. On the way up here, I was reminded about the last time I spoke at a conference in Warwick. And on the train back, I was queuing in the buffet car for a coffee or whatever. And the chap in front of me was asking for a sandwich, and the lady in the buffet bar was saying, well, do you want some salad with that? And he said, oh, yes, I better do. I've got to get my 5 a week. And she said, oh, dear, love. She said, it's 5 a day. And he looked at her ashen-faced. He said, you can't be serious. I just imagine what his face was like the morning he woke up to discover it was 7 a day. You know, very difficult for the public. There's a real role for Public Health England, public health professionals, on helping to cut through some of that conflicting advice to give good, authoritative, respected voice to those key messages, to help people find a way through those complex and sometimes contradictory pieces of advice. A great example of that, I thought, was the challenge for everyone in public health of translating the 1,000-page technical report from the Scientific Advisory Committee on Nutrition, SACN, on sugar that we had a few months ago, to convey some simple and sensible advice around diet, because I was really strongly of the view, it's something I talked to Duncan about often before the report came out, that if it just ended up with experts having a conversation with experts, really it just wasn't going to work. This needed to be a trigger for a national conversation. And actually, I was really pleased with the way it did trigger a national conversation. The clips on the news, the pieces on the radio were all about people discussing where fizzy drinks fitted into their family's diet, why they didn't just put jugs of water on the table, all of those things. And I think it was really important to do that. We can't just talk expert to expert. It is the public's health, and they have to be part of the conversation. And it means that people like your good selves who are expert in all of this have got to help make sense of it, particularly when there's some quite complex science there as well. We have to talk to the public about these issues and get that national conversation going. Because there doesn't seem to be a day that goes by without some headline or other warning us of the latest public health time bomb. The language is often sweeping, it's sometimes apocalyptic, and it can create the impression that the health of the nation is out of control, that there's nothing we can do about anything, that it's all just going to hell in a handcart. And so, you know, there's lots of people out there who would look at that and just think, well, if that's the case, what's the point trying to change? But we know that's not true. It's important to challenge that all too familiar narrative which overlooks the bigger and often improving picture on public health, including obscuring some really important facts. Duncan mentioned some of them earlier, but it's worth recounting them. The number of smokers in our country is at an all-time low, dropping to under 20% for the first time. Teenage pregnancies, as he said, at their lowest level for 40 years. The proportion of women smoking whilst pregnant has been decreasing for the last 8 years, with figures out just today continuing that downward trend at 11.5%. Childhood obesity rates are stabilising. The number of teenagers who describe themselves as regular smokers is down from 10% in 2003 to just 3% last year, bringing the prospect of that first smoke-free generation just into view. The number of pupils that have taken drugs is down from nearly a third in 2003 to below a fifth. 10 years ago, a quarter of young people had consumed alcohol in the previous week. This is now less than 10%. These are huge achievements. led by many of you here today. You should be really proud about that, and we must celebrate them because it proves that you can make progress. And it's particularly encouraging that we're seeing those biggest changes amongst the younger generation. We all know, though, that we can't afford to be complacent. There are big challenges. Duncan rightly said that whilst we can be positive about childhood obesity levelling off, it's at too high a level. We know there's much more to do. But let's not overlook, with our focus keenly on those things that there's more to do on, let's not overlook the areas that we've made progress on, because what they do is they give encouragement. Now, as a minister, I've seen a number of brilliant local examples of the delivery of public health services, and I was really pleased that we were able to celebrate some of those fantastic stories at our Excellence in Public Health Awards that I held in Parliament earlier this year. And for me, that event summed up everything that's wonderful and dynamic about what I've been seeing in the localised public health system. The nominations we received from MPs and directors of public health around the country were just terrific. We had a health checks manager in Cornwall doing health checks on the quayside to make sure her local fishermen's health was being cared for. We had a group of parents in Harrow who'd set up their own fresh fruit and veg stalls in a playground to encourage healthy eating in the whole community, children and adults. We had a doctor in Gloucester who was championing better care for the mental and physical health of homeless individuals. And on a tour of local initiatives at Easter, I saw an absolutely fantastic Regional Age UK project that had identified and mapped every vulnerable older person in their area, and were using that data to work with the local council to prepare an individualised winter plan with those councils. That's brilliant and almost certainly life-saving innovation, and it was all there, just taking place in front of us, wonderful stories that we read about. And the great thing is, all of those people were doing it with a huge enthusiasm. We mustn't ever let public health get put in the killjoy pile. Helping people to be healthier should be fun, and what was great about all those projects, and the only thing where we want to encourage infection is enthusiasm, and I saw it in spades. It was fantastic. But we know that we want to do more to change things, to believe we can do better, and to drive that change. And I want to give you an example that's very personal to me of just how quickly we can drive change if we really all set our minds to it. Some of you will know that I'm passionate about preventing female genital mutilation, FGM. It's been very much my mission issue as an MP. I formed the all-party backbench group when I was a backbencher, and now as the Public Health Minister, I have the honour of taking forward our prevention programme, where we're working to improve the way the NHS tackles FGM. The programme is focused on making sure the NHS can protect girls, that we can prevent FGM, and that we can care for those many tens of thousands of girls and women, many more than we thought previously until we got recent up-to-date data, who have undergone FGM. We're improving what information is held about patients with and at risk of FGM by standardising and increasing the details recorded right across the health system at a regional and national level. We're going to have improvements in place by April 2015, which are going to be delivered through a published data standard. And this data will be used to support the provision of NHS services, because you can't plan services without data. We never really squared that circle before. How do you plan to care for people who are suffering from a secret and illegal practice? So without data, we can't plan services. So data is vital. And that expands the NHS data work that we launched in April of this year, which required basic details to be recorded and for basic anonymised data to now to be able to be passed on to those public bodies that needed it. And that's now being received, the first batches of data from hospital trusts, and we're due to publish the first information next month. The next stage of the work will provide additional requirements on how and what, where, and how the information about FGM will be recorded, and it will set standards for the exchange of information between all health professionals. Now, these are all important technical changes, but what really drives change is an act of collective will, and that's what we didn't have before, but that's what we're now seeing within the public services, with health at the lead. And I've seen the difference that makes on the ground. In my own constituency, I've seen the change that it's making to real people's real health. The practice nurse who told me that this summer she was asked by dozens and dozens of mothers for advice about how to protect their daughters when they went overseas on holiday. The elderly woman asked for the first time in 40 years about her FGM, and her GP asked her if that might be the source of the constant infections and illness that she'd suffered over many years. The women who came to my surgery and sat there and simply said, "We suffer, and we need you to keep going what you're doing." And the Somali women who, when I first became an MP, I couldn't get a meeting with, and we couldn't get into the discussion, and they are now on my brilliant Director of Public Health's FGM task force, driving change across the borough and within their own community. Now, no one can tell me that change isn't possible, because I've seen that journey. I've been on that journey with all those great clinicians and midwives and campaigners, and in just 3 years, that landscape is transformed. So no matter how intractable the problem, with an active collective will and everyone working together, we can make change happen. So my challenge to PHE is to be the engine of change in public health. I want to see them drive progress in some very specific areas, supporting sustainability of our NHS by being ambitious for vaccination rates, whether that's flu or HPV. I want to see PHE continue the ambitious work they've started on physical activity. Over the next couple of days, you're going to talk about the role, I think often unappreciated and under-realised in the past, about the role of physical inactivity behind so many devastating diseases. We now know so much more about the positive role that being physically active can play. But we need to bring that message to life. We need to make it resonate in a memorable way for the public. And we're not there yet, but PHE are on that journey. They're doing a really important piece of work, and I've challenged them to see how can we translate that into something as memorable for nearly everyone as 5 a day. But most importantly, my big challenge to PHE is how do we accelerate excellence? How do we fan the flames of that fantastic health innovation that I've seen as I've travelled around the country, and that I know Duncan has seen on his many visits to local government leaders? How can we ensure that our fantastic public health pioneers feel encouraged and supported, and see that when they get onto a good thing, that soon everybody else knows about it and we can all get onto that good thing? It's a really exciting challenge, and one to which we must all rise. I thank you very much for everything you do. I look forward to hearing about the rest of the conference. I look forward to working with PHE on rising to that challenge in the future. Enjoy the rest of the conference.